Blood pressure.
The ventricular contraction generates the fluid pressure, called blood pressure, that forces blood through the pulmonary and systematic circuits. So, blood pressure is the force the blood exerts against the inner walls of blood vessels. Such a force occurs throughout the vascular system. The blood pressure is most commonly refers to systematic arterial blood pressure. Arterial blood pressure rises and falls in a pattern corresponding to the phases of the cardiac cycle. When the ventricles contract, their walls force the blood in them into the pulmonary arteries and the aorta. As a result, the pressure in these arteries rises sharply. The maximum pressure achieved during ventricular contraction is called the systolic pressure. When the ventricles relax, the arterial pressure drops, and the lowest pressure that remains in the arteries before the next ventricular contraction is called the diastolic pressure. In humans, normal systolic pressure of a young adult is about 120 mmHg, which is the amount of pressure required to make a column of mercury in a sphygmomanometer rise 120 mm. Diastolic pressure is approximately 80 mmHg. These readings are expressed as 120 over 80.
Now, we will discuss about the hypertension.
High blood pressure, also called hypertension, is the blood pressure that is higher than normal. The higher your blood pressure level, the more risk you have for other health problems such as heart disease, heart attack, and stroke. What are the signs and symptoms of high blood pressure? One of the most dangerous things about high blood pressure is that you may not know you have it. That's because high blood pressure doesn't have any symptoms unless it's very severe. The best way to know if your blood pressure is high through regular checkups. Some of the symptoms are severe headache, fatigue or confusion, irregular heartbeat, and some other. What causes high blood pressure? High blood pressure may happen because of unhealthy lifestyle choices. Certain health conditions, such as diabetes and having obesity, can also increase the risk for developing high blood pressure. High blood pressure can cause serious health problems that may affect your heart, brain, kidneys, and eyes. High blood pressure can damage your arteries by making them less elastic, which decreases the flow of blood and oxygen to your heart and leads to heart disease. In addition, decreased blood flow to the heart can cause chest pain, also called angina, heart attack, which happens when the blood supply to your heart is blocked and heart muscle begins to die without oxygen. Heart failure, a condition that means your heart can't pump enough blood and oxygen to your other body organs. High blood pressure can cause the arteries that supply blood and oxygen to the brain to burst or be blocked, causing a stroke. Brain cells die during a stroke because they do not get enough oxygen. Stroke can cause serious disabilities in speech, movement, and other basic activities. Adults with diabetes, high blood pressure, or both have a higher risk of developing chronic kidney disease than those without these conditions. What should we do to prevent high blood pressure? You can prevent high blood pressure by the following ways. Reduce salt to less than 5 grams daily. Eat less salt to prevent hypertension. Eat fruits and vegetables regularly. Add vegetables and fruits in your daily diet. Avoid saturated fats and trans fats. Avoid junk food. Avoid tobacco. Your lungs can also stay healthy by avoiding tobacco. Reduce alcohol. Be physically active every day.
You will stay healthy by using these precautive measures.
Here are shown the blood pressure categories. Your blood pressure is normal if your systolic pressure is less than 120 and your diastolic pressure is less than 80. Elevated if systolic pressure is 120 to 129 and diastolic pressure is less than 80. If your systolic pressure is 130 to 139 and diastolic pressure is 80 to 89, it will be considered the hypertension stage 1. If systolic pressure is 140 or higher and diastolic pressure is 90 or higher, it will be the hypertension stage 2. You have hypertensive crises. If your systolic pressure is higher than 180 and diastolic pressure is higher than 120, you should consult the doctor immediately in this condition. In contrast, if your systolic pressure is less than 90 and diastolic pressure is less than 60, it will be low.
I hope you liked the video. Thanks for watching.
Do subscribe the channel for more videos.